The topic for this dissertation is job satisfaction of home healthcare nurses. The problem driving the research is that acute job demands and dissatisfaction contribute to high nurse turnover. Home healthcare leaders lack strategies to improve job satisfaction, resulting in low nurse retention. Job satisfaction is one of the key components in retaining nurses in any healthcare setting. There is a high percentage of nurses who are experiencing high levels of dissatisfaction and low levels of motivation, creating the underlying issue of reevaluating their profession. Understanding the consequences of job dissatisfaction and tracking the organization's level of nurse satisfaction can provide an early indicator of intervention to influence the level of care delivered, improvement in the retention rates, and overall job satisfaction. The problem is interesting for the field because gaining understanding of the elements that influence job satisfaction could potentially create a dialogue for home healthcare nurses, leaders, and healthcare practitioners to develop retention strategies based on the findings. The study needs to be done to understand the elements that influence job satisfaction among home healthcare nurses. The study focuses on describing the elements that the home healthcare nurses perceive as influential to their job satisfaction. Understanding the elements that the home healthcare nurses perceive as influential to home healthcare could lead to retention strategies. The method used for this study was a qualitative method with a case study design. The advantage of using qualitative research is that it allowed the researcher to extract in-depth data and illustrate the context. The case study design promoted an approach to collect exhaustive, authentic descriptions to promote exploration of the phenomenon and gain a better understanding. Keeping a qualitative perspective and adopting a descriptive case study design helped illuminate a holistic description of the research study with a written context to illustrate the case. The primary skills developed from conducting the research study are interviewing and analyzing the data. The interviewing process was an interesting skill to learn, which can only be learned through experience. Each interview continued to get easier and led to a flowing conversation between the researcher and participant. Analyzing qualitative data was another primary skill that came with experience. As a no-voice researcher, it took the experience to understand the qualitative data software is only a place to store and organize data. The software is a tool the researcher uses to discover the themes that emerge from the data. Through this process, I learned that compiling, disassembling, reassembling, interpreting, and concluding the data were primary skills needed to analyze qualitative data. The secondary skills developed from conducting the research derived from the interviews and document reviews. Taking field notes and making observations during the interview process was crucial during the data collection process. The field notes comprised of observations and perceptions from the interactions between the participants during the interview phase. Field notes were read to the participants to ensure no bias was injected into the responses. Additionally, document reviews helped develop a skill necessary to find and locate documents that helped understand job satisfaction. In this case, the document review process helped the researcher confirm some level of job dissatisfaction among the nurses in the agency. One important thing discovered through the study is that the impact patients have on job satisfaction. Most of the elements that were discovered throughout the study are elements that influence many professions, such as pay and leadership. These are elements that can influence other professions and isn't centered toward healthcare. However, the home healthcare nurses expressed the influence patients have on their job satisfaction, and it was an element that empowered them. At the end, the majority of the nurses found elements that contributed both negatively and positively toward their job satisfaction and were able to balance their levels to continue their employment at the time of the interview.